Hi there, my name is Heidi Van Wessem, and today I'm going to be talking to you about my findings from a literature review that has been conducted in relation to females going through menopause and whether or not is flaxseed versus a placebo or no treatment more effective in reducing hot flushes. So, what is menopause? So, by the year 2030, it is expected that 47 million women will be experiencing menopause. It occurs between the ages of 45 and 50 years old and is defined as when women have not experienced a period for at least 12 months. And this can last up to 10 years. A fluctuation in hormones, specifically estrogen, an estrogen withdrawal can exert stress on the body, which can result in hot flashes, night sweats, and mood changes. Now, hot flashes, they're defined as spontaneous sensations of warmth, sweat, or chills, and can cause sleep disruption, interrupt daily activities, and can reduce quality of life. So, how can flax seeds possibly work on reducing hot flashes? Well, flax seeds, they are an anti-inflammatory seed. They have high antioxidant properties and lipid modulating effects. What's their mechanism of action? Well, they contain phytoestrogens. Now, these phytoestrogens can actually bind to estrogen receptors, which mimic estrogen within the body, which is where women are experiencing an estrogen withdrawal when they go through menopause. So what we're going to discuss today is we're going to look through evaluating the research and whether or not the efficacy of flax seeds, if it has an effect on reducing hot flashes. So what did I do? Well, we conducted a literature research method using two search engines. This included PubMed and Sinhal Plus, the years between 2010 and 2020. Key search terms were included such as menopause, climacteric, perimenopause, or menopausal. The seed was flax, linseed oil, or lignin, which is the specific active component within flaxseed or flaxseed itself. Hot flash or hot flush was termed for used for the hot flashes. The comparison placebo or no treatment was not involved in the search method and was left open for interpretation at the time. Menopause rating scale, hot flushes, a Kupman index, and the change in mean frequency and severity were all outcome measures that were seen across these papers. So the validity and results and clinical relevance was measured through the Critical Appraisal Skills Program. So from here, I was left with 36 articles. From this 36 articles, I used the referencing software Mendeley, which removed any duplicates from the two search engines. Following this removal of duplicates, inclusion and exclusion criteria was used. Exclusion criteria included articles that were review articles, meta-analysis, full text articles that were not available, or mainly the dietary intervention was not relevant to flax seeds, or if it had a flaxseed component in there, it was not specifically just flaxseed. Also the years, it had to be relevant within the last 10 years. So from here, I assessed 6 articles for eligibility. Within those 6 articles, 4 were relevant due to the 2 other full text articles that did not have the specific dietary intervention that I was after, which was flax seeds. From here, these are the 4 studies I was left with. The first study we can see is by Seletsy et al. That was a non-randomized control trial that went for 3 months with 140 people. They had 2 intervention groups. One group contained 5 grams of flaxseed per day and then increased up to 300 grams for the second month onward. And the second group had the exact same dosage of flaxseed. However, they also had an education booklet on how to reduce menopausal symptoms and how to handle them. The 2 control groups within this study was hormone replacement therapy, which is not discussed within this literature review, and also no placebo or no control group. So there was no other treatment in here. It just observed their effects throughout the time. The second study was by Collier et al., who was a randomized placebo clinical control trial for 6 months with 75 people. There were also similarly 2 intervention groups, 1 gram of flaxseed extract per day, and the second group had 90 grams of flaxseed meal. You can see here the 2 grams of the lignin amount that's been provided, which is the active component within each of the flaxseed groups. The third study by Pruthi only went for 7 weeks with 146 people, but was also a randomized controlled trial. The flaxseed group had 1 intervention and 1 control group. The intervention group was 7.5 grams of flax seeds, and the control group was a placebo. The fourth and final study was by Symbolester in 2010, which was a randomized control trial with 38 patients, went for 3 months. They contained 1 group with the intervention of 25 grams worth of flax seeds through bread, and the second one was an intervention with a placebo-like bread as well. Now, what did we find through these results? Well, the first study indicates that there was a decrease in the use of flax seeds. So group 1 and group 2 decreased by a good amount, and the variable group, which is the hormone replacement therapy, decreased even more. However, there was an increase in the results of menopausal symptoms by 6.9% with no treatment. Now, there's a limitation within this study. This is the fact that they group their menopausal symptoms together. They can include hot flashes under the umbrella term somatic complaints, which includes this, but it also includes another array of menopausal symptoms. Therefore, it is actually inconclusive for supporting this research question. The second study by Colley indicates a strong, statistically significant reduction through the use of hot flashes in severity of hot flashes, not length of duration, just severity, for both the flaxseed extract in group 1 and the flaxseed meal in group 2. And you can see here the control with the placebo group was not statistically significant at all. The third group identified that there was no statistical significance for the reduction of flax seeds. We can actually see here that the placebo group had a 50% more reduction of hot flashes in comparison to the flaxseed group. The fourth and final study was that the group 1 did have a reduction of flax seeds with the use of flax seeds for hot flashes. However, so did the control group, so did the placebo group. So therefore, in comparison between the flaxseed group and the placebo group, there was no statistical significance. From this, so what does it mean? So there were a few strengths that came out of this, and that was that there were 3 of the 4 studies were randomized control trials. They identified an objective, intervention, outcome measures, and findings with no attrition bias. And they're all relevant within the last 10 years to ensure that the research is up to date. There were limitations, as I said before, along with the poor recording of the hot flashes in regards to intensity, frequency, and the duration of them. 2 studies did not identify the age of the women involved in the study, and 1 study did not identify the type of flaxseed and the quantity of the lignin provided. The variation of the length of studies varied from 7 weeks, where that study actually had 1 week of education and 6 weeks of active use of flaxseed, to 6 months, and from 1 gram of flaxseed to 90 grams, which is quite a significant variation. There was some dropouts within the studies. 2 studies had elevated dropout rates, 1 mainly due to the side effects or efficacy, and also there was a study that had 2 dropouts because they were unsure of how to fill out the diary. The adverse effects, as mentioned, were reported mainly based on the flatulence, intestinal discomfort, and gastrointestinal complaints. Now, these studies reported this due to the high fiber content. Similarly, there was 1 also placebo group that experienced these adverse effects, and this is also because the placebo group had the same amount of fiber content. So what does all this mean? Well, so to conclude, 3 of the 4 studies are not statistically significant for the reducing of hot flashes with the use of flax seeds in menopausal women. It identifies that further research is to be carried out, specifically for larger sample sizes, duration, and the amount of lignin within the flaxseed and the specific type of flaxseed must be specified. There is evidence that suggests that possible education or weight loss has been beneficial for reducing hot flashes. So whether or not a study could include education, weight loss, and the use of flax seeds is still something that needs to be further researched and investigated. I hope you enjoyed my presentation. Thank you very much.